Hello, everybody. Thank you for listening to the Healthy Project podcast. I am your host, Corey Dion Lewis. I have two great guests in the building with me today. I have the CEO, Marina Borukhovich. Oh my goodness, I knew I was going to kill this last name. I'll let you say it.
Yeah, we'll say it.
It's Borukhovich.
Borukhovich. I practiced that for like an hour.
You're doing good. You're doing better than most.
Yes, CEO of YourCoach Health and the COO, correct? Eugene.
Correct. And then try the last name again. Come on, no.
You can do it.
Borukhovich.
Yes.
Lord Jesus.
It's
I can
okay.
edit it.
It took a really long time to get it down too, so it's okay. No worries.
Hey guys, thank you so much for being with me here today. I really appreciate your time.
It's our pleasure. We're excited to be doing this.
Yes. So we're all in the health coaching space, so I'm super excited to have this conversation because I have a lot of questions for you guys. But before we begin talking about, the coaching and all of that, tell us a little bit about yourselves and kind of what gets you up in the morning.
You want me to start and then you'll go in?
Sure, go for it.
Kind of quick background. I always joke around that I'm either a recovering entrepreneur or a recovering executive. I am now a recovering executive for the last 2 years. And the alarm does not wake me up. It's, I love building teams. I love building companies. I love building products. And there's no better way to do it than with your lovely wife. So that's what gets me up in the morning.
I was waiting for that you love building it all with me.
Yes, exactly.
Okay, that's great. So we've been building this company together since January of 2020 when Eugene left the big pharma. So we're 2 years in and we're still doing okay. So, there's something to be said for that.
Absolutely.
Yeah, so I'll go next. I started out as a developer many, many years ago. I've had multiple entrepreneurial ventures, but mostly in fashion and event design, which is where my passion lays as well. And this is my first venture into health and wellness. And I've always been so excited about it and so passionate about it. And it's always just played such a huge role in everything that I do that it was the only natural progression. That was really the next step. So what gets me up in the morning, being able to, our mission here is by 2030 to bring health coaching to the projected 8.5 billion people worldwide, to whoever wants it. And that's my personal mission. That's the mission of this company. And that doesn't just get me up in the morning, it propels me in the morning. I literally jump out of bed and I'm excited every single day to see what more can we do.
That's awesome. So what was the genesis of YourCoach Health? Like, what was the problem you saw, or like the problem that you faced that you felt like this platform needed to be out there?
I think like most founders, this started with a very personal story. And, I never had to reach far when I had to tell my story, right? Because it was just right there. And I had my battle with breast cancer when I was 37 years old. It was 7 years ago now. And just going through it. And I realized what was missing for me personally, holistically. And that was just that whole well-being, the holistic well-being, mind, body, and soul. And I went on to become a health coach really for myself, to hack away at my body and to heal myself. After the doctors were done with the miracle that they did, right? They gave me my life back. I thank God every day for modern medicine. Became a health coach. Then we can never leave well enough alone. So Eugene was like, well, you cannot coach with pen and paper. And we just felt that everything that was out there wasn't working. So, then you build, right?
And actually, the YourCoach.Health as a domain was really registered for Marina's personal practice before it became, a company.
Yeah. So YourCoach was never meant to be a company. It was your health coach, right? So YourCoach.Health. That health domain just became available at that point. So we were super excited that I was able to do that, right? In YourCoach. There's no better name than to work with your clients. Yeah. So started building a platform for me, and then started talking to people who I went to school with, and everybody was getting excited about it. So more people started using it. So it became a platform for health and wellness coaches. And then, around 2019, we had these like great ideas of what more we can do with it, just to bring it to more people, right? Like how can we help more people? And that's when we realized that at the heart of it all, yes, it's this practice management platform. But what we truly do is we bring coaches to companies for their members, for their clients, for their talent, basically to anybody and individuals, right? To anybody who wants a health coach. So we have health coaches who are practicing on a platform with their own clients. And then our algorithms identify which ones of those practicing coaches practicing on our platform will be a great match for an individual who is looking for one, because that's the only way to do it, right? We can't just, somebody's looking for a coach and there's a million directories out there. Do you really want to sit and parse through 500 individuals that have every category listed with what you're looking for? Nobody has time for that. So this is where we come in and we give that perfect match. So that was really long.
No, that is great. And I tell you why that's so dope to me is because as a health coach myself, and we get, and probably a lot of health coaches that may be listening to this right now, you get bombarded with these different platforms that say, hey, come to our platform and be a coach, or be a health coach for us. And there's really no plan on the plan is just build out a really good profile and they'll come to you. You know what I mean? It's like, well,
and by the way, they charge an arm and a leg for this. They upsell you. I mean, we get bombarded, because on LinkedIn, right? I'm listed as a health coach. People don't read anything else past what they need to see. I get bombarded all the time from companies and individuals who are trying to sell me something, services like this.
And
Yes.
I think the other aspect, Corey, and you kind of mentioned that, everybody's getting bombarded by companies, et cetera. There are people that want to work full time and love that, right? They are up in the morning, probably like yourself, at 5 a.m, doing things, and then heading into the primary care setting, helping those great patients to get better. And there are people that want to run their own business and make maybe a little bit more different, different hours, different scheduling. And we're seeing this gig economy of health coaches is on the rise, not to mention the great resignation. Many people are leaving full-time jobs and more flexibility.
The great reshuffling.
I agree.
So at our symposium, one of the speakers called it the great reshuffling. And I like that so much more because people are not leaving the workforce. They're going to where the conditions are better. And especially now, and we talk about this all the time, it's, the home and work lines are blurred. People are working from home all the time. A lot of them don't really want to go into offices. So the emergence of this virtual care is just mainstream now. Everybody's comfortable. Most people are comfortable with it. They are proponents of it, right? So this is where we come in. So these coaches who work so hard on building their practices in education and their knowledge base, we help them with more clients. And what we do is not here, there's some cold leads and you can speak to these people. They're real clients. When we match you, you can start working with that client today. They're vetted, they're paid, they're ready to go. So that gets rid of all of that, right? Because health coaches go into this, you don't want to go and solicit business. You want to help, you want to coach, you want to do.
Marina always says, in any relationship, partnership, and this is not just among human beings, but companies, and everybody needs to do what they're best at, right? And so, right. We are best at providing a virtual home for the coaches and their clients, and we're best at providing this amazing workforce and talented workforce with opportunities, right? And that's our kind of value add in the ecosystem, right, that we're building.
And truly nurturing this community, because I know community is such a buzzword and everybody has one or is building one. We truly have this community of coaches that communicate with each other. We have a community manager that is there with them every step of the way. They're helping each other. They're praising each other. They are just cheering each other on and helping. I mean, it's amazing to watch. It's amazing to watch this unfolding and just pat myself in the back a little bit to see where it started and how we built it. And where I pat myself in the back is that I surround myself with the most amazing team. Every individual that works for us, anybody from the tech team or the executive suite, everybody comes with the same passion and the same goal to make an impact. And that is how we're doing what we're doing.
Right. Community is just, even though it's one of those buzzwords, like you said, it doesn't change the fact that it's important. Like, it's just important having that community that can do that. And speaking more about your community and the health coaches within your community, you know, as we know, there, it sounds like you have these people who are ready for coaching, and you're setting them up with coaches. How are you kind of figuring out, okay, does this health coach has the right credentials or the right background for this individual, for this client? Are you vetting the coaches as well? Or what is that? I'm sure you are, but what is that process like?
Yeah. So it's a little bit of our secret sauce, right? So we're not going to, tell you exactly what it is, but so basically, I know.
We'll give you hints.
We'll give you hints. So at the heart of it, sure, we need to see their certification. So first of all, for them to work with their own clients, they can graduate, the school of health coaching school of one, and they can work with their own clients. We don't regulate that. But for us to be able to recommend them to our clients, we need to see their certifications, and we absolutely vet that. Some of our clients are looking for background checks. We absolutely do that. We have a video call with every coach. We make sure that we know exactly who it is that we are setting people up with. Where the secret sauce comes in is we have the algorithms on the platform that we file patents for. And this is why it's so important for coaches to actually practice on the platform with their own clients, because the algorithms based on that can pick out who we can best match you with. So after that initial match, there's not going to be any of that, oh, I'm not sure if this person is right for me. After that initial match, they're going to have a fruitful, ongoing, sticky relationship where they truly make a difference. Actually in each other's lives, because I feel like clients really make a difference in the coach's life as well, because every client that we help, it helps us grow as well, right? And there's something to be said about making a difference. That's the part that I'm most excited about.
Absolutely. Absolutely.
That.
No, I'm gonna hold my breath for other questions. That was whew, perfect.
Perfect. So with the behaviors you've seen from the coaches on your platform currently, and the maybe the feedback you're getting, or the questions they're asking each other, I don't know how you're seeing that, but where do you see health coaching like right now at this moment? Like, what are some of the trends the current trends you're seeing?
Yeah, maybe I'll kick this one off. So I come from health care, right, environment, and I think there's been a tremendous buzz around health coaching in the industry. And let's go across health and care and digital health and digital therapies, primary care, clinical trials, right? Everybody's talking about health coaching, but I do think that we still need to educate quite a bit the industry on what it is really, because I think healthcare today as an industry is very much thinking of health coaching. Well, there could be some, food, nutritional aspects. Yes, there could be, but again, and Marina will chime in a bit more on that. Is there fitness, right? Yes, there could be. And so I think as I describe it when I took my 9 weeks, non-clinical psychotherapy, and really diving into what that really means, what is truly health and wellness coaching, I think there's a lot of education to do. So in short, I think the industry is recognizing there's a need, but I think the combination of the doctors don't have time, the nurses are also swamped with, very much of administrative tasks outside of what they're really there to do, as in patient care, right? And not that coaches are not busy, but I think from a science-backed approaches that coaches are taught, right? It's an amazing talent and workforce that has been underutilized. And now I think to a certain extent, the healthcare system is looking at it as a maybe potentially less expensive resource to work on adherence or compliance and other things. So I do think we as an industry, that's where it's at today. There's still a lot more education that we all can do to educate sideways up consumers, executives, and others? I don't know if.
Yeah, I just feel like, we talk about this all the time. Health coaches are widely underestimated. A lot of companies that do hire them use them as nudgers, kind of like a phone call. Did you take your medicine today? Or did you check this off today? Right. But health coaches are so much more than that. So it is our job as a platform, as a business, to educate companies out there and actually educate health coaches who are going into this as well to what this profession really is.
And
go ahead.
Yeah, no, I was going to add, so I think that's kind of more of a health and wellness coaching as a definition. I do think, and this was actually quite a lot of the decision-making process when I was leaving big pharma. I think everybody or all the health coaches that are listening to this, obviously aware the MA and the national board, right, released the test CPT codes into the VA, the Veterans Administration.
Yeah.
And so I think that was a tremendous move, and huge kudos to the national board and all the people involved and the AMA to kind of continue pushing this forward. And I think again, as we talk about where it is now, right, health coaching, I think that also brought, I don't want to use the word legitimacy, right? I just I think
we're still looking for that word.
We're still looking for that perfect word. I think it's bringing much more awareness now that the AMA also is sort of behind it. And so I think that's what started this. And again, right, I mean, health coaching, this better than us. It's been around for 20 plus years, right? So I think that's where it's at now. I think it was a great announcement by the national board that with, I think, USC, if I'm not mistaken, off the top of my head, the real world data collection is also starting now to move those level 3 CPT codes to actual reimbursement. So this is huge news for the industry. It's not there yet. Got a long way to go still. But again, I think this was honestly a tremendous, I'll say win for the industry. So far.
And what I was going to say, and I'm glad you kind of cut me off so I can be mindful of my words. But what used to be very frustrating to me as a health coach, especially, I mean, years ago when people really didn't know what health coaching was, or they knew what it was, but they tried to act like it really wasn't all that. Like, it was just like, well, what do you do? Well, you know what I do. Like, I'm like, you know what I do. You know the value I bring. It's obvious. And like you said, health coaching has been around for so long. It's hard for me to really think that you don't see the value in coaching, and it all comes around to, can we bill for it? And that was just very kind of frustrating for me. And the way I see it is, well, if we're looking at kind of like this value-based care model, and we're looking at, there are other people that can utilize, coaching, me as a, example, I work for a federally qualified health center. All of the patients that I see would never be able to afford a health coach or work for a company that would be able to afford, that has, a corporate wellness program. So I think it's great now that it used to be very frustrating that we had to get like this validation from the healthcare system to be able to be like, okay, yeah, you guys are real. but yeah, but now it's like, okay, we got to do what we got to do to get to where we need to be.
But I just want to jump on this a little bit, and sort of me starting to educate myself on health coaching as Marina got into it, due to what we all went through, surrounding it. I'll be frank. I mean, prior to that, I think just the fact that there's so much crap out there as far as, and I even called it like cuckoo voodoo science that also named, health coaching. And, I think while the healthcare system is rigid and there's so many improvements we can make, it does bring the sort of scientific validation to almost any process, et cetera. And again, we all get frustrated as patients on the other side of it that it takes so long. But again, right, we went from kind of this perception of some cuckoo voodoo science, as I keep calling it, to a science back, which again, to your point, Corey, it's always been what you've studied, what you've been, but there's a lot of noise as well.
Yeah. And I think that's something that's been a big problem. And I don't think that problem's going to go away until, some of the stuff that's happening now really gets done. It's just going to be there, and something that a lot of coaches have to unfortunately deal with until, things change.
Well, we're here to help.
Absolutely.
So reach out, and we're happy to spread all the wonderful coaches that are doing great work inside the healthcare system, and
to build awareness.
Yeah.
I mean, truly to build awareness as well, what health coaches are all about, that it is scientifically validated methods that they're using, at least the ones that we recommend that we can stand behind as a company.
Right. So we know where it started. We kind of know where you guys feel like it's at right now. And it sounds like the platform really started catching steam at the perfect time around 2020, if we all know what we're talking about.
Yeah.
It really started catching steam there. Before I ask my next question, one just popped up. What was going through your mind as you're building this platform and you're kind of seeing in the background this thing they're calling COVID-19, this pandemic, and you're trying to build this platform to where, because it sounds like you started building it before you even knew about, before the pandemic even became a thing. So what is going through your mind as that hit and you're building this platform?
Yeah, so we were in the midst of building it. We had something already. And I almost feel bad saying this, but as horrible as the pandemic is, that was actually really good for us. So we were actually raising our seed round in the middle of the pandemic. And we shook a little bit in the beginning, right? Because you no longer have face-to-face conversations with VCs. Nobody's traveling anywhere. We're not showing our faces at conferences because we were still very much in stealth mode, doing all of this.
Right.
And as soon as we started conversations and we got so many people reaching out to us, there was so much inbound traffic. And as everything went virtual, everybody started talking more and more about this virtual care, and everybody started talking about YourCoach a lot more. And a lot of people started approaching us as we're raising the seed round. So we kind of, we wiped the sweat off and we're like, oh, okay, I think we're going to be okay. I think we're going to be all right. So the pandemic actually, as a business, it actually did help us. And it helped a lot of the coaches on the platform to help their clients, where it was a lot of face-to-face before. One thing it did for us, because we were building a mobile platform first, because our platform is mobile and web-based as well. So we were building a mobile platform because everybody was always on the move. And as soon as the pandemic hit, we had to switch over right away. And we started building our web version because now everybody was at home in front of their computers. So you just got to go with the flow, right? You got to go with the times.
Yeah.
To add a little bit more at the societal level, right? I think the pandemic really exposed the inequalities and the social determinants of health and comorbidities. And, the fact that looking at prevention and actually focusing on health, not sick care. So a lot of that in the last 2 years have been really put in the, really in the front lines of all the discussions, right? And we do feel that, all of a sudden in the last 2 years, while again, to your point earlier, Corey, you've been in the healthcare system as a health coach, but we believe that in the last 2 years is when, the terminology and the profession really was brought in the front lines to a certain extent, along with the doctors and the nurses that, really started saving us all, right, through this pandemic.
When there was so much focus on you got to build up your immune system and you just got to be in your best shape, right? People just started, filling themselves with vitamins, right? But people who've been using health coaches, this is what we've been talking about for the longest time, right? It's preventative. You got to be ready for things, right? And not start to figure things out when it's already, I don't want to say too late, but when you're already in the midst of something, right? So it definitely brought a lot of light to what health coaches do and how important the profession is.
Right. So outside of changing how coaches were able to work with their patients, clients, were there any other changes or things you're thinking about as you look in the future of coaching and how the pandemic really kind of put a spotlight on things? Are there any things that you guys are thinking, hey, maybe we should be thinking about this in the future to maybe improve the platform and just kind of be ahead of the curve like you've always been?
Yeah, I mean, like one thing that we've seen right away is the migration of healthcare professionals to health coaching. So we've seen a huge influx of nurses who were just really frustrated with everything that was going on, and they were becoming health coaches. There's a lot of doctors on the platform who wanted to get educated as well, and they're becoming health coaches. People are building practices around it where it's several individuals and they're helping clients in tandem. So we've seen that. I know
pharmacists, right, who are actually trained by profession, motivational in motivational interviewing, are going out and saying, look, let's get actually additional training as a health and wellness coaching and potential certification. So it's use the word of reshuffling the healthcare system and hopefully more into the preventative side of things. Of course, I think we're struggling as a core healthcare system. For that talent already, but let's hope that this kind of reshuffle is actually helping all of us as health consumers be more healthy in a preventative fashion with the wonderful army of health coaches.
And as a platform, I mean, as a business, we're very well aware of it. So we're going with the times and we're always building to service the greater audience. And what we're doing now by making health coaches available and health coaches who have different things that they can bring to the table, because it's N equals one. There's no cookie cutter approach to this at all. And this is what we wholeheartedly believe. And the more we see, the more of these trends of who is migrating over in the professions, we're able to offer a better match to those who are looking for a health coach.
Going a little bit to your actual question, where do we see this? So this is more of a migration of talent and individuals. We do see, and we have honestly a lot of inbound that we as a still young startup need to always prioritize. But if you think about any health and wellness and care products, right? We're seeing inbound from medtech companies. We're seeing inbound from life sciences company around clinical trials, right? Can we add health coaching around it? There's a lot of challenges to solve in each one of them, and I'll pick clinical trials. Is health coaching an intervention or not, right? So we need to look at, how do we study that? Digital health companies broadly, virtual care companies, telemedicine companies adding, you're in a primary care setting, right? So insurance companies, literally across, right? And that just goes to show where we see health coaching is in everything from disease management, disease reversal, preventative care, and to a certain extent, even the performance, right? Let us as human beings be the best versions that we can be given what we got, right? And this is not athletic performance per se.
It's a process. It's a process. And I've always said this, as human beings, we ebb and flow all the time. And what I needed as a patient 7 years ago is very different than what I need now as somebody who's just looking to take care of my well-being and to stay well.
Right.
So, and what I need today and tomorrow and yesterday, they're all different things as well. So it takes that army of health coaches, and we're still figuring it out. We always will be. We always will be. And we're seeing where we can help the most and where we can come in. And, I think we're doing an okay job at it.
We'll let the coaches and our partners speak for themselves. I'm just going to add a couple of more things around, more kind of, let's talk healthcare and sort of process a bit. I think what we're going to start seeing is much more credentialing, just like, the doctors and the nurses get credentialed. Mm-hmm. And so we feel that we as your coach are a number of steps, ahead. So I think the credential part, I do think that, everything from kind of the taxonomy codes and, national provider, the NPI numbers, and, getting ready for some of the reimbursements along with, more and more outcome studies kind of with and without health coaching, which we are in the process of refreshing our health coaching report. So version 2.0. It's coming, hopefully early Q2. So a lot of that will be seen and updated by us where we see this all going. And I think we're going to start seeing not actually just reshuffling of the workforce, but I think augmenting the knowledge and the skills of the existing workforce across what we described earlier in kind of health and wellness coaching, and even potentially going for the national board certification, whether they use it as a coach or not. So I'm trying to think if we missed any other predictions here.
I don't know. I feel like we've just been talking and predicting. So
No, I love it. That's
clearly
awesome.
We have a lot to say.
Yeah, no, it'd be pretty awkward if you didn't have anything to say. I'm like, hey, like, okay, what are we doing here? Awesome. Well, Marina Eugene, thank you so much for being on the podcast with me. Like I said, I've been super excited about getting the Jay-Z and Beyonce health coaching on the podcast.
Look at that.
We're still going.
Let's give a shout out to Justin Massa on this one, right? If you've seen it.
Yes, absolutely. If anybody listening wanted to get a hold of you guys and learn more about YourCoach or learn more about you or anything you're doing, where can they find you?
We're YourCoach Health on all the socials. Our website is YourCoach.health, so you can reach out to us there. We're really easy to find. So, and
awesome.
To add, well, I know you have Your Health Eugene.
Yeah, I mean, I'm 24/7 on Twitter, so Health Eugene, pretty easy. But again, if some people prefer email, it's team@YourCoach.health as well.
And we'll both get that.
Awesome. Well, again, guys, thank you so much for being on the podcast with me today. I really appreciate it. And everybody, thank you for listening to the Healthy Project podcast. I'll holler at you next time.